Hello, I'm Bob Kieserman from the National Library of Patient Rights and Advocacy. There's been much concern within the medical community and the patient community about major changes in our healthcare system. Medicine is being practiced quite differently than it was even 10 years ago. And for most patients, it is frustrating, to say the least. Today, my guest is Dr. James E. Harper, a physician from Georgia who is board certified in internal medicine. Dr. Harper has an interesting medical career history and has recently published a book called The Decimation of U.S. Healthcare. He is greatly concerned about the present state and future of the practice of medicine in this country. Today, he is here with me to discuss his thoughts about what has happened and what lies for the future. Welcome, Dr. Harper. Thanks for joining us.
Thank you.
You've had an interesting medical career, and I'd like to begin by asking you to tell our audience about being a volunteer physician for 29 years. What exactly is a volunteer physician, and what kind of work did you do?
Okay. Well, I'd like to first say, Bob, that I'm one of Jehovah's Witnesses. After completing my education and training, which took 11 years, and becoming board certified in the specialty of internal medicine, I worked for a few years in emergency medicine in Atlanta, Georgia, since I completed my residency there at Emory University. And from there, I volunteered as a physician at the then world headquarters of Jehovah's Witnesses in the Watchtower in Brooklyn, New York. And in that capacity, I worked as a physician without pay for over 29 years, although food and shelter were provided. I was in Brooklyn for almost 19 years, and then myself and my wife were transferred to the Watchtower Educational Center in Paterson, New York, where we remained there for more than 10 and a half years. And in Brooklyn, I was among four other physicians who provided emergent, urgent, and ambulatory medical care for a population of over 4,000 other volunteers, ranging in age from 19 to my oldest patient reached the age of 106. And we provided 24/7 care, sharing a call rotation through the week as well as on the weekends. And we also had inpatient facility that we could admit patients to who required more intensive care. Also, I had staff privileges at Long Island College Hospital, which is located in Brooklyn, as well as Mount Sinai, which is in Manhattan, and so that I could admit patients there, or if they needed to be assisted in providing post-surgical care for them. Likewise, I was on staff at Putnam Hospital, which is located in Mount Carmel, New York, while at Paterson. And I also cared for missionaries as well as volunteers at different branches of Jehovah's Witnesses all over the world who would come to see me at least once a year. And therefore, I have also experience with tropical medicine. And while at Patterson, we changed our weekend call schedule so that one physician could cover the entire U.S. branch. And this consisted of five different locations, five different facilities in New York, covering more than 6,000 volunteers by telemedicine. And this was in collaboration with nurses that were on duty as well as EMTs at each facility. We also had ambulances at each facility in the event that someone needed hospitalization.
Fascinating, totally fascinating. Um, it is very interesting work, very commendable work. And then in 2023, you opened up your own practice in the town of Johns Creek, Georgia. Um, and according to your book, you were shocked at how much the quality of medicine in healthcare had declined. What were some of your observations made as you began to practice on your own?
Well, as you recall, the COVID-19 pandemic began in this country at the end of 2019. Now, ironically, I returned to the private sector in Georgia from my volunteer work 1 month prior to the start of the pandemic.
Oh,
And during that time, the U.S. healthcare system virtually collapsed, according to all everything that I observed. For example, COVID-19 was primarily attacking the lungs, yet this country did not have sufficient ventilators for all the people that required them. Thus, many people died due to respiratory failure. Also, there was insufficient protective equipment, including caps, gowns, and facial masks to protect against this highly contagious virus, of which there was virtually no immunity. As a matter of fact, was the case prior to the vaccination. Therefore, many doctors and nurses died in the early stages of the pandemic. When I began my private practice after the pandemic in 2023, I was confronted for the first time in my life with having to deal with health insurance companies which operated like legalized scams without government regulation. Their business model seems to be to maximize premiums to patients while paying out as little as possible for the patient's medical care. I was forced to accept dramatically discounted rates for payments of visits. In my book, I actually disclose that the Medicare fee schedule, which determines what is paid to medical providers, has actually been cut by a total of 34% for the last 24 consecutive years. Also, health insurance companies will either deny payments for visits or grossly underpay uh, the payment. And there's nothing, or actually very little, that the provider can do about it. Many patients have huge deductibles and are left to pay for office visits and at times even hospitalization out of pocket. Of course, this is at their prearranged discounted rates.
that was a difficult time, and I may ask what prompted you to come back into private practice.
Basically, because my work there was no longer uh, needed.
Politics aside for the moment, how are you feeling about the recent discussions and decisions that have come from the government that will affect our current healthcare system?
Uh, First of all, I'd like to state that I'm politically neutral.
Okay,
Um, One side promotes the Affordable Care Act tax subsidies, while the other side does not.
right.
But frankly, neither position uh, will correct the problem with our healthcare system. For example, prior to Medicaid expansion with the Affordable Care Act, what was happening is that community hospitals were closing at record rates due to being forced to provide care for uninsured patients. Now, many previous community hospitals have reemerged as privately owned hospitals who have no interest in quality health care, but instead their interest is only to amass huge profits. Also, dramatic cuts are in store for Medicaid by the end of 2026. Likely, there will also be cuts in Medicare as well. Now, this only will worsen the current healthcare problems that we have. In addition, the public trust of the entire healthcare system has been undermined in this country and will continue to erode. The recent CDC recommendations for a reduced vaccine schedule for children will lead to outbreaks of previously controlled contagious diseases. For example, measles, which is the most contagious disease known to man, will become epidemic throughout the country and may become life-threatening to both younger and older ones. This is the worst flu season and the most fatal in almost 3 decades. The recommendations regarding not vaccinating against hepatitis B in various settings, uh, for example, with pregnant women, will lead to a subpopulation living with a completely preventable chronic disease that could, over time, the hepatitis B could actually destroy the liver or it could transform into liver cancer. Now, should we have another pandemic, which is quite likely, the entire healthcare system could collapse. And furthermore, if people follow the new food pyramid guidelines, we will see a dramatic increase in cardiovascular disease, diabetes, obesity, and cancer.
Well said. Um, so I certainly read your entire book. It was fascinating to me as an observer of healthcare. I share many of the thoughts that you do about our healthcare system. Um, but what were the main messages that you set out to make in writing your book?
Well, uh, I was inspired to write the book due to my desire to find out exactly what happened to our healthcare system to make it deteriorate so badly. In the more than 30 years that I had been working in a quote unquote bubble, so to speak, from
Right.
the current, away from the current system. And what I discovered is that the once autonomous physician uh, is really a thing of the past. At least 80% of the physicians in this country are now employees and are leaving the practice of medicine in record numbers. Now, prior to that, most physicians had a private practice. Um, now, uh, this is true to a much greater degree with so-called primary care physicians. The reasons are very complex, but it boils down to two things. One is that they're overworked, and two is that they're underpaid. The root cause is that corporate equity, primarily third-party health insurers, have basically infiltrated and taken over the entire healthcare system. Um, they have been empowered to do this by a legalized scam, plundering billions of dollars of taxpayer dollars for several years. The corporate goal is to increase profit at any cost. The patient has basically become the victim, and the physician has been pushed aside for less expensive non-physician medical care. And eventually, the goal is to replace everybody with AI. My book sounds the alarm that if nothing is done soon, the entire healthcare system in this country will be unable to care for the people.
Very sad. Very sad. Dr. Harper, I know that when I've gone recently to the doctor, been going on for about, I don't know, a year. Um, Almost always I'm seen by a physician assistant first. And then maybe I'll see the doctor for maybe 5 minutes. Physician assistant will do all the intake and examine me. And then the doctor, the physician or the MD or the DO will come in and they'll examine me and say hello. Um, you spend some time in your book raising concern about the use of nurse practitioners, physician assistants to replace the physician in many settings. Can you share your thoughts on this concern?
Yes. Um, to begin to answer that question, though, I would like to use a question to illustrate my point. Um, which would you rather have to design your new home? An architect or a carpenter? Also, which would you rather have perform your open heart surgery? An experienced cardiothoracic surgeon or an orthopedic surgeon who is newly trained? The point is that the training, education, and experience of the medical provider dramatically affects the outcome. For example, a nurse practitioner or NP requires a Bachelor of Science in nursing, which requires 4 years of college. They must also have an active RN license and complete either a 2-year program to achieve a master's degree in nursing or a 4-year program to achieve a doctoral degree in nursing. On the other hand, a physician assistant, which is a PA, requires a 4-year bachelor's degree in science related in a science related field, any science related field, and must complete a 2 to 3 year master's degree program in learning how to assist a physician. Now, uh, not trying to magnify myself, but I completed, in contrast, a 4-year Bachelor of Science degree in biology, 4 years of medical school to achieve my doctoral degree in medicine, not nursing or physician assisting, but medicine, followed by a 3-year residency in the specialty of internal medicine, of which I'm board certified. Now, the difference is a general practitioner is a MD. They have completed the same basic education with college and medical school. But the difference is they have completed 1 year of an internship in whatever their field is of their choice. And a family practice physician, on the other hand, has the same education, college and medical school. But the difference is they have a 3-year residency that's more general with about 20% internal medicine. Yet, the interesting thing is, and this is what I discovered from my investigation in this book, is that many urgent cares and emergency rooms in the U.S. are not staffed by physicians, but instead by PAs and or NPs. In fact, my book reveals that many urgent cares throughout this country have no physician on site. Now, think about that. When you have urgent or emergent care, you need the best care possible.
Right.
But that's what's available in this country. Many primary care clinics throughout the U.S. have only non-physician practitioners, either NPs and or PAs. Multiple studies have shown that the care provided by non-physician advanced practitioners is inferior to that of physicians. Yet the reality is that the physicians are in fact leaving the practice of medicine in droves in the U.S. And this is most evident in the case of the category of primary care physicians. In fact, many corporate entities, including third-party health insurers, have the goal to replace all of us with artificial intelligence in order to maximize their profit margins.
Mm.
So the simple fact is that doctors are more expensive than NPs or PAs, and AI is even cheaper.
I don't know if you know this, I come from an academic background. I was a professor until I retired of healthcare administration. And I always thought it was interesting that with these large universities with thousands and thousands of students, they did not have a doctor working, a physician working in health services, that an MP or a PA was managing the entire student body and the faculty. And that always bothered me a lot. So I really concur with what you just said. It's frightening. Um, the last time I had to go into the ER, I was surprised to see that the attending person was a PA. And he was calling the shots in terms of what had to be done. Dr. Harper, finally, with all that's going on right now in healthcare, in your opinion, what's the future of healthcare delivery for the next 5 to 10 years?
Well, Bob, I sadly believe that the trajectory is headed in a downward spiral unless major changes happen quickly. The U.S. population is steadily aging, meaning that people are living longer with chronic diseases, while the amount of physicians to care for them is dwindling. We presently have a healthcare system where the third-party health insurance company, or Medicare, to a lesser degree, functions basically as a non-medical primary care provider. And this is accomplished by controlling who the patient can see as a provider or as a referral subspecialist, which hospitals they can receive
Right.
care at, which other ancillary services that will be provided or will be paid for example, physical therapy or something like that, as well as which prescription drugs will be covered. Now, unless there is a revival of primary care and a shift away from the practice of shuffling the patient from one subspecialist to another, the healthcare system will continue to deteriorate. Now, internal medicine is a specialty that involves the medical care of adults, while pediatrics is a specialty that involves the medical care of infants and children. Now, both are categorized in a rather demeaning fashion by health insurance companies, not as specialists as they are, but instead as PCPs, which is another name for primary care, not physician, but provider. And yet the two fields are completely different. Now, allowing both the internal medicine specialists and the pediatric specialists, respectively, to be the point man, so to speak, doctor, would dramatically decrease healthcare costs and improve overall care rendered to patients. And I also actually cite different studies in my book that demonstrate this without a shadow of a doubt.
Yes.
Importantly, third-party health insurance companies and other corporate entities should be permanently banned from government programs such as Medicare and Medicaid. They have plundered billions of taxpayer dollars by exploiting these programs for several years directly under the nose of lawmakers. They have only one goal: to amass huge profits, even if it means sacrificing the patient's well-being and the physician's practice. And by eliminating this counterfeit form of payment to physicians and hospitals for medical services rendered, I believe would lead to a healthcare system that will be viable and that would be enabled to provide much better care to the people it serves.
This has been fascinating, absolutely fascinating for me, and I'm sure for my audience. Uh, Please tell my audience where they can obtain your book. How can they obtain your book?
Well, it can be obtained on Amazon and as well as Ingram Spark. So both of those platforms it can be obtained through.
Very good. Thank you so much, Dr. Harper, for being my guest in a very interesting conversation. And I appreciate taking your time. I'm Bob Kieserman from the National Library of Patient Rights and Advocacy. Thank you very much for joining us.